Welcome to Rethink Healthcare. It's the famous Wendy Ball and
Mr. Montenegro.
Mr. Montenegro again. Okay, that never gets old, does it?
That's my name.
That's true. Okay, so what are we talking about today?
Jobs.
Jobs.
You want to talk about jobs. I guess the question was from your students, right? As far as what are their job outlooks. I mean, as you know, Miss Ball here, Wendy Ball, is a very good LPN instructor. And
The best. Come on, let's get that right. Yeah.
high up top.
Yeah.
She is a very good instructor.
Give me a shout out, students.
Yes. So the question was job outlooks. I mean, from my perspective, right? From what I'm seeing, you can not worry about getting a job. I mean, I work a lot in a long-term care setting, and the job postings never.
There's always a job.
Yes, the job
Always
postings.
a job
At least,
available.
not just that. I've actually seen some, and this you're gonna laugh. And I had this conversation with a nurse a couple of days ago, and we talked about staffing issues and staffing ratios. And she says she's an RN who floats, and she also does agency.
In the long-term care facilities.
Long-term care facilities,
Okay.
yes. So I asked her, hey, how's the market like out there, right? Because she does per diem, and she does agency.
Okay.
Now, she actually told me that due to the shortage, some agency rates for LPNs are $20 higher than some RN rates.
Wow.
I was shocked. I'm not going to say what the rate was, but just so you know, that rate is higher than what I make as an NP.
Ooh, so it doesn't necessarily matter the letters, not the numbers, the letters.
So it's the supply and demand, and so if you think about that, right? In the long-term care setting, they have to have certain ratios and mandates on how many RNs versus how many LPNs. Well, in a shift, sometimes they only need one RN.
Yeah, usually it's just one
But
RN.
they might need 4 LPNs. So if that RN role is filled and the LPN role is short, they have to fill more of that. Supply and demand, economics, the rate goes
Now, how
higher.
about if we're talking about job outlook? So we know there's jobs out there, but do all the LPNs want to work in long-term care? Is there other opportunity?
I think from what you were saying before, they're encroaching some more back into the hospital system again, which I think is, if you look at a skill mix and appropriate the right roles, I don't see any issue why an LPN couldn't be in the long-term care, in the acute care setting.
So that might be a little harder to get than the long-term care setting.
Yes, it might be, because it would take a lot of buy-in from administration and nursing leadership in those systems to really relook at the whole structure. It's all about structure. I actually have no problem with LPNs even being in the intensive care unit, but they're there in a specific role. They don't necessarily have to manage the patient primarily. They could be there doing all the assisting, as far as they could certainly change a catheter. You know, they could certainly do wound care, right? They're not going to push IV meds. I mean, you have your license restrictions with those. But, an LPN role could certainly do more than what, let's say, a nurse's aide could. Let's say in the ICU setting.
Absolutely. Yeah? And I see, I've heard that they've been in urgent cares.
Yes.
And as school nurses, along with obviously the supervision of an RN.
Okay.
But the great place I love, I was an emergency room nurse for over 10 years, and I was also in home care for over 10 years. We had lots of excellent LPNs in home care.
In home care?
In home care, and I love that as a place. So I think as a home care nurse, though, you have to have experience. You have to be autonomous in that you're the only person there with that patient, right? So if something's going wrong, you need to know what to do or when to call for help. So I think that's a great spot, a good outlook for LPNs as an alternative place to work.
That's actually very interesting to me, because I would have thought that they would have been a bit more limited in the home care end just because of the autonomy. I mean, I could see them being pushed into structures wherein there's a licensure mix.
So there is
Right.
a mix. So obviously the RN has to go out and do the
Initial assessment, yes. Initial
And
assessment.
then the RN has to at least see that patient every, I think, 4 or 5 visits has to be done by an RN.
Okay.
And then the RN does go out and do a supervision once a month of the LPN.
Okay.
So there is oversight.
So they could be very specific focus. Let's say that it's a wound care visit. Then
Oh yeah, they do. They go and do the wound care.
I
They do
see.
teaching. They do. I've had some LPNs, and I will tell you, if you're an LPN out there, you are valuable. You are needed. And I've had LPNs that were even better than some of the RNs that I know, because it's what you decide as a nurse, how educated you're going to be, what you're going to put into your career and your job. So yeah, there's out there. There's a lot of a good job outlook, I think.
You know, I never thought about that because I also practice in home care as a nurse practitioner, and I get a lot of calls from the home care agencies. To me, they're a nurse. I don't ask.
You probably wouldn't know.
They're an RN, LPN. No, I don't ask that. They're just a nurse who I'm interacting with, and I treat them equally. There's no difference to me. I mean, from as a provider, as a nurse practitioner. As long as I'm getting the information I need when somebody gives me a call about a case, if I get the proper information, then there's no issue. So it didn't matter to me whether there's an RN or LPN. I actually, frankly, don't know.
So for our last, we have like a job fair at the school that I work at. And the last one that we had, they were even having sign-on bonuses.
Wow.
Yeah, so I love that nursing. You're always going to have a job in nursing, no matter what type of nurse or education level you have. There is always a job for you to have. Sometimes you get your pick of the litter. You can pick any job you want. Sometimes there's great bonuses out there, and sometimes you can't be as picky. But right now, we are in a time,
high
2024 right
Yes.
now, high demand. Go into this profession, into nursing, into healthcare.
There's always a swing. I mean, when we learn in school, there's swing back and forth with supply and demand. And I think when we graduated, the demand was low when we graduated. But I haven't,
I got hired as a GN out of school.
Yeah, she's special. I had to take a year off before I find a job because I didn't want to bother competing with everybody else. So I said, I'm just going to
just wait a little bit.
Yeah, I'll go travel.
Yeah.
So once I start a job, if it's full time, then I have to ask for vacation.
I know, seriously.
So I didn't do that. But here's the thing: I haven't seen it swing where there's an oversupply.
No. You can always get
and,
it.
And as I always like when my kids were asked for what career should I do, right? The advice I give them is you should pick something that, number one, not only do you love, but then number two, if there was a war, if there was something catastrophic going on, are you still needed?
That's great advice.
And in healthcare, you're always needed.
Yeah.
Someone's always going to get sick. That someone's going to need healthcare. I don't think there'll be an oversupply of nurses in the near future, just because the number of nurses that are retiring are also pretty high.
Yes.
So
there's always that cycle going on.
I don't think it's going to catch up. We could go through the number statistic, but it doesn't really matter. That's just a number. I mean, we're telling you what we're seeing on the ground, and
there's always sick people, so you're always going to be needed.
I'm going to need a nurse at some point in my life.
Yeah.
Will you be my nurse?
No, Mr. Montenegro. I'm going to need a nurse then too.
Okay.
Yeah. Will you be my nurse?
If you want me to.
Oh, he's so nice. Put me to shame. So the outlook for these LPNs or anybody in healthcare is high.
Good.
We're saying go for it. Go for it. Get out there.
As long as you're going to enjoy taking care of people.
And you have that passion.
Yes.
To care for people. Because we don't want to we've all had that nurse that was just awful, right?
I mean, that's just life. Not everybody. I mean,
I know. So I've had a waitress that's been awful, right? We've had everybody.
I will be an awesome. I mean, I'll be an awful waiter.
Yeah.
Because I'd be like, "You're eating that?
That's terrible."
Yeah, you're gonna die. That's a lot of calories." Anyway, enough of that.
Okay.
Go follow your passion.
Oh wait, we forgot our.
Oh yeah, high five now.